I'm Frank from the Frank and Lizzie Show, and today we're going to talk about what's in my bag. No measurements, no objective data, that's really guessing, and that's not how I practice. When I walk into a patient's home, I divide what I carry into three sections: the assessment, the wound management, and the compression section. Because in the home setting, precision matters. Now, the assessment section, I do want to do vitals, so I carry my automated blood pressure cuff and a pulse oximeter. I also carry a Doppler to assess arterial waveforms, and in the event that I don't have this information, I can combine it with a manual blood pressure cuff to perform an ABI. It gives us how much compression we should get. And to measure swelling, I use a tape measure to compare both extremities. I also use wearable pressure sensors. There's two out there and I love them both, but there's no guessing how much compression we're applying to the patient, so now I can measure it objectively. And for tissue oxygenation, I love to use near-infrared spectroscopy and thermography from Mimosa Diagnostic. This assesses tissue oxygenation and detects inflammation or ischemia early on. So really, physiology often changes before the wound declares itself, and I'm able to see what's happening at the wound surface section. Now, for cleansing, I use hypochlorous acids, ideal for soaking, reducing bowel burden. I like to use a paper ruler sometimes to measure the wound bed, but Mimosa Diagnostics can provide that for us electronically. For debridement, I carry a full debridement kit along with Histologics tools, Kylon technology for debridement. And then the dressing section, not to sponsor one of them, but I want to optimize the tissue environment, also manage excessive exudate, and I love these products. Not every wound needs absorption, so now we got to consider balance. And lastly, in the compression section, compression bandage doesn't start with a bandage, it starts with skin care. So I want to apply a low pH lotion to support the acid mantle and protect the skin integrity. Also, I have other options, a 2-layer compression system, but also I have a short stretch bandage system and a toe wrap that I can create to decongest the extremity, essential. I also carry this gray foam for extra padding. We can shape the extremity as we need to, and I can deliver the right amount of pressure. I also have non-bandaging compression. In the home setting, I see what others don't. I see how they live, I see how they elevate their leg extremity, and truly how they manage their condition. My role is to bring objective data, clinical precision, and practical solutions into the real-world environment, collaborating with physician providers and wound care clinics. That's what's in my bag. And that's how we elevate lymphedema and wound care. Now I want to know what's in your bag.